Welcome, family. In today's knowledge, let's talk about identifying or diagnosing blocked fallopian tubes. Watch till the end as I talk about diagnosing and understanding the causes of blocked fallopian tubes. Understand that you may have no symptoms. Though some women with a particular kind of blocked fallopian tube may experience abdominal pain or increased vaginal discharge, most experience no symptoms at all. In most cases, women only discover the problem when they struggle to get pregnant. Make an appointment with your doctor if you are unable to get pregnant after trying for a year. From a medical perspective, infertility means that you are not pregnant after at least 1 year of regular, unprotected sex. If this happens to you, schedule an appointment with your primary care physician or gynecologist as soon as possible. If you are over 35 years old, you don't have regular menses, or you have tested for ovulation and tests are negative, don't wait a year. Schedule an appointment after 6 months of regular, unprotected sex. Note that infertility is not the same as sterility. If you are infertile, you may still be able to conceive a child, with or without medical help. Do not assume that you will never be able to get pregnant. Schedule a fertility evaluation. Your doctor will probably recommend a complete fertility evaluation for both you and your partner. Your partner will need to provide a sperm sample so that a specialist can rule out a problem with sperm count or motility. You will likely need various tests to confirm that you have normal hormone levels and are ovulating properly. If all of these tests come back normal, then your doctor will recommend checking your fallopian tubes. Consider a sinohistogram. Your doctor may recommend undergoing a sinohistogram, a medical procedure that involves using an ultrasound to look for masses in the uterus. Your uterus will first be injected with saline water so that the doctor can see better during the ultrasound. Uterine masses can sometimes block the fallopian tubes. Fibroids, polyps or other masses near the fallopian tubes could cause the blockage. Have a hysterosalpingogram. A hysterosalpingogram, HSG, is a medical procedure in which a special dye is injected through your cervix and into your fallopian tubes. X-rays are then taken to determine if the tubes are open or blocked. Hysterosalpingograms are done without anesthesia, and you should experience only mild cramping or discomfort. It can help, however, to take ibuprofen about an hour beforehand. This procedure usually takes 15 to 30 minutes. Potential risks include pelvic infection or damage to cells or tissue from radiation exposure. If your doctor suspects that your tubes are blocked, they may use an oil-based dye during the procedure. The oil can sometimes remove the blockage. Ask your doctor if a laparoscopy is appropriate. Depending on the results of your sinohistogram and hysterosalpingogram, your doctor may recommend a laparoscopy, a medical procedure in which an incision is made near your navel to find, and, in certain cases, remove, any tissue that is blocking the tubes. In general, laparoscopy should only be performed after other infertility testing has been done. This is partly because it is a riskier procedure. It's done under general anesthesia, so it carries all of the risks associated with any major surgery. Get a diagnosis. The results of these tests should determine whether one or both of your fallopian tubes are blocked. Ask your doctor to explain the extent of the blockage. Having specific diagnosis as possible will help to determine a treatment plan. Understanding the causes of blocked fallopian tubes. Understand that sexually transmitted infections, STIs, can lead to blocked fallopian tubes. Knowing the cause of your blocked fallopian tubes may help your doctor formulate an effective treatment plan. Sexually transmitted infections are some of the most common causes of blockages. Chlamydia, gonorrhea, and other STIs can lead to the development of scar tissue that blocks the fallopian tubes and prevents pregnancy. This can be a problem even if your STIs were treated and resolved. Know the role of pelvic inflammatory disease in causing blocked fallopian tubes. Pelvic inflammatory disease, PID, can result from sexually transmitted infections and lead to blockages. If you have PID, or a history of PID, you have an increased risk of developing blocked fallopian tubes and infertility. Be aware of the potential risks associated with endometriosis. In women with endometriosis, uterine tissue grows outside its normal location, implanting on the ovaries, fallopian tubes, or other organs. If you have endometriosis, know that it can lead to blocked fallopian tubes. Recognize the role of uterine infections. If you ever had a uterine infection, perhaps in connection with a miscarriage or abortion, it's possible that scar tissue formed and blocked one or both fallopian tubes. Although uncommon in the United States, pelvic tuberculosis may also cause blocked fallopian tubes. Factor in past ectopic pregnancies. Ectopic pregnancies are those in which the fertilized egg implants in the wrong place, usually in the fallopian tube. These pregnancies cannot grow to term, and when they burst or are removed, they can cause scarring and blockages. Consider past surgeries. If you have ever had abdominal surgery, your risk of developing blocked fallopian tubes is higher. Surgeries on the fallopian tubes themselves are especially risky. I hope you find this helpful. Please subscribe for more interesting, evidence-based, educative and informative videos. Like and share this video. Turn on your notification icon so you can be notified when next I drop a new video. I desire for you good health and long life. See you in my next video. Till then, stay safe and remain healthy. Peace.